In November 2005, my in-laws came over for Thanksgiving. I like my in-laws. This is a different story. After dinner, my father-in-law, Sully, was telling me that he was having some pain in his shoulder for the last few weeks when he was swimming. I thought maybe it was tendonitis or some other overuse injury. And we talked about, when he got home, him going to see his regular doctor for a checkup. 3 weeks later, my mother-in-law called. Sully was in the hospital. The doctors found a tumor in his cervical spine. It was cancer. The primary tumor came from lung cancer. It was fatal. I flew up north and visited Sully in the hospital the day after he had his surgery to debulk the tumor. I walked into the hospital room. He was sitting up with a neck collar on and asked how he was doing. He said he was doing okay. The surgery went well. He was getting good medical care, but he didn't feel like he was being treated as a person. And I asked him to explain what he meant. He said, well, the hospital staff are coming in my room and they don't introduce themselves, they don't smile, they don't explain to me what they're going to do, and then they walk out. And he said, I've been getting a lot of tests today, and the transport staff, put me in a wheelchair, they wheel me downstairs. They talk to the other staff, but they don't talk to me. They don't acknowledge me as a person. I kind of feel like I'm a piece of meat getting carted around from place to place. And I'm hungry. I'm supposed to have a test today with sedation, and because I'm getting sedated, I can't eat. And I said, Sully, it's 9 o'clock at night. Are you sure you're getting this test? He said, I'm getting this test. They promised me I would get this test today. So I said, well, let me check. So I found the resident and asked, and she said, a trauma case came into the hospital this morning, and your father-in-law's procedure was canceled. We should have put in an order so that he could eat, but it was an oversight. I remember standing in the hospital family lounge looking at the city skyline and thinking to myself, what's wrong with this picture? I'm standing in one of the world's most famous hospitals with one of the best reputations, and my loved one does not feel like he's being treated like a human being. Something's broken. In 1915, Henry Ford took a tour of the brand new Henry Ford Hospital. When he finished his tour, he turned to the hospital administrator and said, well, I see you've designed the hospital perfectly to fit the needs of the physicians instead of the patients. 100 years later, how much progress have we made? Have you had an experience in healthcare where you felt that your needs were not put first? Have you ever called the doctor's office for an appointment and you were told you had to wait a week or a month? Did you ever call a subspecialist and were told you had to wait 2 months? A lot of us have had this experience, and it's frustrating. But what if you were calling for help for your elderly mother or your child? And it doesn't have to be this way. There are modern scheduling techniques we can use that use queue theory to get patients access to the appointments they need. Now, whenever I mention waiting in healthcare, many people think back to their last visit in their local emergency room. And my colleagues in emergency medicine always yell at me when I talk about the emergency room, and they tell me, we don't work in an emergency room. We don't work in a room. We're a department. It's the emergency department, not the emergency room. Okay, fine. It's not a room. But if you're making people wait for 6 hours, I'm not sure it's an emergency either. We can measure the time it takes to get to see a triage nurse, the time it takes to wait to see the doctor, the time it takes to get blood tests back, to get an x-ray, to get another consulting physician to come downstairs, and then the time it takes to get admitted up to the hospital or sent home. And all these steps can have delays and make for big wait times in the emergency room. And if the hospital upstairs is crowded or if they're short-staffed, then those delays will trickle down to the emergency room. But many hospitals are tackling delays in the ER. And they're working on smoothing out their flow upstairs so those delays don't impact the flow of patients downstairs. Other hospitals are letting patients make appointments for the ER online. So if there is a wait, you can wait from home instead of coming in. ER delays are a solvable problem. Now, I have 2 kids, and they hate getting blood work. And in pediatrics, we can do things to maximize comfort and decrease pain around procedures. We can use distraction. We can use numbing cream. We can even have kids cuddle a golden retriever while they're getting their blood work or an IV placed. And for more invasive procedures like catheterization of the bladder, we can use nitrous oxide for sedation to make sure kids don't have pain or a memory of that procedure. And it's not just for kids. We should think about adults too, and we should think about every way we possibly can to decrease pain around procedures. I don't like blood work either. I hate it. For me, it's not so much the needle. It's tying that tourniquet around your arm and pinching the skin. That just drives me crazy. One day I was getting blood work, and I didn't feel any pain. And I turned to the phlebotomist, and I said, "Did you use a tourniquet?" And she said, "Honey, for all my patients, I tie the tourniquet around their shirt sleeve so it doesn't pinch the skin." I said, "I want to hug you because you just saved me from pain for all my future blood draws." Every time we do a procedure on a patient, we should offer them all the comfort measures we have to decrease pain. And in healthcare, our job is to think of ways to decrease pain, decrease fear, decrease anxiety, and decrease suffering every chance we can. We were talking about blood draws, and has anyone ever been in the hospital overnight and you were woken up to get a blood test? Many hospitals start collecting their blood work at 4 o'clock in the morning. There are phlebotomists who troll around the inpatient wards. They collect their blood samples, and then they disappear before sunrise, just like vampires. Why do they do that? Does anyone know why they do that? Well, in the past, it would take hours to process these blood tests, and the doctors would want their lab results on their patients for morning rounds. But with current technology, we can now run these blood tests in seconds or a couple minutes. There's no longer a need to wake patients up at 4 o'clock in the morning. Can everyone in the room here agree that in hospitals we're going to abandon collecting blood work at 4 a.m.? Can we all agree that we're going to let patients sleep and heal while they're in a hospital? So we've talked a little bit about the patient experience. What about the experience of healthcare professionals? Now, burnout among caregivers is epidemic right now. And burnout is a problem because it's a barrier to empathy. 45% of physicians report at least one symptom of burnout. Half of physicians would report they would change their career in medicine. And 60% of physicians are planning to retire earlier than expected. The seeds of burnout are sown early in medical school and residency training. 75% of internal medicine residents report burnout, and what's even more troubling is that many of them report a lack of emotional reaction to the death of one of their patients. It seems like our healthcare culture is driving empathy out of our young doctors. We need to restore empathy. If we can do that, the waits for appointments go away, the waits in the emergency room go away. Waiting through the weekend to hear if your child's cancer returned goes away. Now, it's amazing when we get this right, because when we do, the comments our patients tell us are, "My medical team saved my child's life. My doctor really listened to me. My nurse genuinely cares." But when we are not empathic, what do we hear? "I felt dismissed. My doctor seemed rushed. I thought I heard some sarcasm." Healthcare systems that are providing an excellent patient experience are finding they make fewer medical mistakes, their patients are more likely to take their medications, and their patients' diseases are under better control. In our pediatric healthcare organization, Nemours, we have a commitment to empathy. We're not going to rest until every patient gets the care they want and need when and how and where they want and need it. A recent survey of hospital CEOs reported that improving the patient experience was their #1 priority to work on over the next few years. We need to return to empathy. Can you imagine if we redesigned the healthcare system based on empathy? What would that look like? Well, I think we would have all the doctors washing their hands 100% of the time instead of the current national average of 50%. We would have 2 minutes of uninterrupted time to tell our story. You could tell a good story in 2 minutes. Typically, patients get interrupted after 18 seconds. We would be able to get an appointment today or tomorrow. We would be able to get medical advice from our mobile device. And in the hospital, the pillars of care would be your healing, your nutrition, your sleep, your pain control, your communication with your medical team. You'd be given choices, and your decisions would be made with your family, and those decisions would be respected and supported. I was walking out of my clinic a few weeks ago, and I walked into our hospital lobby, and I had my hospital ID and my stethoscope around my neck. And 2 parents came up to me, and they said, "We want to tell you about your hospital." And my first thought was to look for security, but I said, "Okay, sure, I'd be happy to hear what you have to say." They said, "We want to tell you how much compassionate care our son has received since being here this week, and we thank you." That's the kind of experience we want for every patient, every time. In closing, Sully was the type of person who did not take no for an answer. He challenged the status quo his entire life. He also jumped out of a plane at age 60 and didn't tell his wife, but that's for a different story. He taught me to always fight for what you believe in. I think we can agree we need to demand the right thing for ourselves and for our family members. Let's only accept a healthcare system that's designed to put patients first.